Talking about transcondylar and transpetrosal, these are the approaches. So we have the occipital condyles. When the physician is inserting a needle or approaching via these condyles, in a transpetrous approach, now what happens is the physician is going to navigate via the petrous part of the temporal bone, which is the most inaccessible part of the brain, and of course it is the hardest part of the skull bones. So via this petrous apex, the physician can very well enter into the cranial fossa. Now coming to cavernous sinus, the venous capillaries are all arranged in the form of a sinus called as a cavernous sinus. Coming to foramen magnum, it is the largest opening that we can find in the skull through which the medulla oblongata continues as a spinal cord. Mechanical thrombectomy, it is a process by which the physician is going to dislodge the blood clot via a device. So the thrombus is being disrupted or destroyed with the aid of a device called as a mechanical thrombectomy.